At Wellness 60 to 100, we know that muscle loss after 60 isn't just aging, it's a warning sign. Rapid muscle decline may indicate age-linked muscle wasting, a silent threat to healthy aging. In this video, learn how to spot early signs and protect your strength before it's too late. At 68, Mr. Harold Lynn had always considered himself fairly strong. A retired carpenter, he prided himself on staying active, gardening, fixing things around the house, and walking every morning. But over the course of just a few months, Harold noticed something odd. He struggled to carry groceries, climbing stairs felt harder, and his once firm grip had weakened. He thought it was just normal aging, until he tripped on a sidewalk and couldn't lift himself up easily. At his doctor's appointment, Harold was surprised to learn he had lost nearly 10 pounds of lean muscle since his last checkup, a sign of sarcopenia, or age-related muscle wasting. He had no idea it was happening. There was no pain, no big warning. Just quiet, steady loss. With early intervention, resistance training, a protein-rich diet, and vitamin D support, Harold began rebuilding strength. Today, he's back to tending his garden and even helps his granddaughter with weekend DIY projects. His story is a powerful reminder: if you're losing strength fast, it's not just getting older, it might be something much more dangerous. I'm Dr. Emily Carter, a board-certified geriatric physician focused on mobility and functional health. Muscle loss after 60 isn't just inevitable, it's preventable. In this video, I'll explain how sarcopenia quietly threatens independence, and what every older adult can do to fight back. Healthy aging begins with protecting your strength before it disappears. Many seniors believe muscle loss is just a natural part of aging, but rapid or unexpected decline could be a warning sign of sarcopenia, a condition that accelerates physical weakness and loss of mobility. In this video from Wellness 60 to 100, we'll explain how to recognize early signs, identify who's most at risk, and take proactive steps to preserve muscle mass. From silent lifestyle triggers to overlooked medical causes, we'll break down everything you need to know. Because healthy aging isn't about surviving, it's about staying strong, independent, and in control of your life for as long as possible. 1. What is age-linked muscle wasting, sarcopenia? Sarcopenia is the progressive and involuntary loss of muscle mass and strength that occurs with aging, often beginning as early as age 50, but accelerating sharply after 60. At Wellness 60 to 100, we stress that this isn't just getting weaker, it's a biological shift that can threaten healthy aging if left unchecked. Muscle isn't just for lifting or walking, it plays a critical role in metabolic health, balance, bone protection, and even blood sugar control. As we age, several factors contribute to muscle decline. Hormonal changes, lower levels of testosterone, estrogen, and growth hormone reduce the body's ability to build or maintain muscle. Decreased physical activity, seniors often become less active due to joint pain, fatigue, or lifestyle changes, accelerating muscle breakdown. Nutritional deficiency, many older adults consume insufficient protein or lack vital nutrients like vitamin D, essential for muscle synthesis. Chronic inflammation, underlying inflammatory conditions such as diabetes, arthritis, or obesity can accelerate muscle loss at the cellular level. Neurological decline, aging also affects the nervous system's ability to stimulate and maintain muscle fibers. The most dangerous part: sarcopenia develops gradually and silently. By the time someone notices difficulty rising from a chair or frequent falls, significant muscle has already been lost. This is why we urge early awareness and action. Sarcopenia doesn't just steal strength, it steals independence, mobility, and quality of life. But the good news is, it's not inevitable. With the right strategies, muscle loss can be slowed, reversed, or even prevented altogether. Healthy aging starts with understanding this threat and taking it seriously. 2. Early signs you're losing muscle, and may not know it. Sarcopenia doesn't announce itself with pain or loud symptoms. Instead, it creeps in slowly, disguised as normal aging. At Wellness 60 to 100, we teach that healthy aging means spotting subtle changes early, before they rob your independence. Here are key signs that could point to early-stage muscle wasting. Red triangle pointed down 1. Reduced grip strength. Struggling to open jars, carry groceries, or hold objects firmly? Grip strength is one of the earliest and most reliable indicators of declining muscle function. Chair 2. Difficulty rising from chairs. If you need to push off your knees or lean heavily to stand up from a seated position, your leg and core muscles may be weakening. Foot 3. Slower walking speed. Are people passing you more often? Gait speed under 0.8 meters/second is a strong predictor of sarcopenia and even increased mortality risk in seniors. Balance scale 4. Unexplained weight loss. Losing weight without trying may seem like a blessing, but if the loss is mostly lean muscle, not fat, it's a red flag. Balance scale 5. Trouble with balance or frequent falls. Muscle keeps you upright. If you're stumbling more, or hesitant to walk without support, it may not be your bones, it could be your muscles. Bed 6. Feeling weaker than usual. Trust your instinct. If daily tasks feel harder, even without a diagnosis, that shift in strength could signal something deeper than simple fatigue. The problem is, these signs are often brushed off. Seniors might think, "I'm just slowing down." But that mindset delays action, and every month of inaction can mean more muscle lost. Don't wait for a fall or fracture to wake you up. If you notice even one of these signs, it's time to assess your muscle health with your doctor. Because by the time muscle loss is obvious, it's already advanced. 3. Who's most at risk for sarcopenia? At Wellness 60 to 100, we believe healthy aging begins with knowing your personal risk. Sarcopenia doesn't affect everyone equally. Some seniors lose muscle much faster than others, not because of bad luck, but because of specific, often overlooked factors. Older adult 1. Adults over 65. After age 60, the body naturally begins to lose 1 to 2% of muscle mass per year. Without resistance training and proper nutrition, this decline accelerates. Bread 2. People with poor diets. Seniors who consume low protein or skip meals regularly are more prone to muscle loss. Many older adults unknowingly eat far below the recommended protein intake for maintaining lean mass. DNA 3. Chronic illness patients. Conditions like diabetes, heart failure, COPD, and kidney disease contribute to systemic inflammation and physical decline. These illnesses often lead to fatigue, causing inactivity, fueling further muscle wasting. Person in bed 4. Sedentary lifestyle. Prolonged sitting or inactivity, especially after injury or surgery, is a major driver of muscle loss. Even a week in bed can dramatically weaken older adults. Pill 5. People taking certain medications. Long-term use of corticosteroids, some cancer treatments, or medications that reduce appetite can trigger or worsen muscle wasting. Brain 6. Older adults with cognitive decline. Seniors with dementia or depression may move less, eat poorly, or forget to exercise, increasing their risk of rapid muscle loss. Person standing female sign 7. Frailty or history of falls. If you've already experienced a fall, it may not be just balance, it could signal muscular weakness already in progress. Being in one or more of these groups doesn't guarantee sarcopenia, but it raises the stakes. That's why screening and early action are critical. Ask your doctor about grip strength, gait speed, and muscle mass assessment if you belong to any of these categories. Awareness is your first defense, because you can't fix what you don't track. 4. The tests that reveal hidden muscle loss. One of the greatest challenges in diagnosing sarcopenia is that it hides in plain sight. You may feel a little weaker, but most seniors don't realize how much muscle they've lost until it's serious. At Wellness 60 to 100, we emphasize that healthy aging requires measuring what you can't see. Here are the key assessments that help detect muscle loss early. Hand with fingers splayed 1. Grip strength test. This simple test uses a handheld device to measure how strongly you can squeeze. Low grip strength is a powerful predictor of disability, hospitalization, and even mortality. Person standing male sign 2. Chair stand test. Can you rise from a chair 5 times without using your hands? Difficulty performing this task indicates weakened lower body muscles and core instability. Person running 3. Gait speed test. Walking speed over a short distance, usually 4 meters, is an easy, proven way to detect early frailty. A slow gait is one of the strongest signs of functional decline. Straight ruler 4. Muscle mass index, via DXA scan or BIA. Dual energy X-ray absorptiometry, DXA, or bioelectrical impedance analysis, BIA, can measure how much lean muscle your body carries. A declining muscle-to-fat ratio, even in people with normal weight, may signal sarcopenia. Stethoscope 5. Timed up and go, TUG test. This test evaluates how quickly you can stand from a chair, walk 10 feet, turn, and return. It identifies both balance and muscular endurance issues. Chart decreasing 6. Blood tests for inflammation or nutrient deficiency. Low vitamin D, chronic inflammation, or hormonal imbalances can all contribute to muscle wasting and may guide targeted intervention. If your doctor hasn't tested your strength or muscle mass, ask them to. Many seniors pass basic checkups because their heart and labs are normal, while their muscles are disappearing. These tests are fast, non-invasive, and can give you years of independence, if done in time. 5. How to fight back and rebuild strength after 60. Sarcopenia may be common, but it's not inevitable. Muscle is one of the most responsive tissues in the human body. Even in your 70s or 80s, you can rebuild strength with the right strategy. At Wellness 60 to 100, we teach that healthy aging is about fighting decline with knowledge and action. Here's how to restore muscle and protect your future. Person lifting weights, male sign 1. Start resistance training now. Strength training is the most powerful tool to reverse muscle loss. Use resistance bands, bodyweight exercises, or light weights 2 to 3 times per week. Focus on legs, core, and grip. Cut of meat 2. Increase protein intake. Seniors need more protein, not less. Aim for 1.0 to 1.2 grams of protein per kilogram of body weight daily. Prioritize lean meats, eggs, dairy, legumes, and protein shakes when needed. Sun 3. Check vitamin D and B12 levels. Deficiencies in these vitamins impair muscle repair and nerve function. Supplement as directed by your doctor. Person walking 4. Move every day. Even light daily walking, stretching, or Tai Chi keeps your muscles engaged. Long periods of sitting speed up atrophy. Warning 5. Avoid crash diets and over-restriction. Rapid weight loss often strips away muscle. Focus on nutrient-rich eating, not just calories. If you're losing weight unintentionally, see a doctor. Brain 6. Train balance and coordination. Combine strength with balance work, like standing on one leg or stepping over objects, to reduce fall risk. Tear off calendar 7. Track progress and stay consistent. Measure improvement in reps, weight, or mobility every few weeks. Progress keeps motivation alive. It's never too late to start, but the longer you wait, the harder it gets. Muscle keeps you standing, walking, protecting your bones, and living with dignity. Reclaim it before it slips away. Your future strength is in your hands, and your legs. Ignoring muscle loss after 60 doesn't just make you weaker, it can steal your independence. Sarcopenia increases your risk of falls, fractures, hospitalizations, and even early death. Everyday tasks like climbing stairs, bathing, or carrying groceries become dangerous challenges. Worse, many seniors who lose muscle never fully recover, entering a cycle of immobility and isolation. By the time visible weakness appears, significant muscle may already be gone. This silent decline leads to expensive medical care, loss of autonomy, and emotional distress. Don't wait until you need help standing up to take this seriously. The cost of inaction is not just physical, it's your quality of life. As a geriatric physician, I urge every adult over 60 to pay attention to muscle strength, not just weight or lab numbers. You might feel fine today, but sarcopenia progresses silently. Start with simple changes. Walk more, lift light weights, eat enough high-quality protein, and ask your doctor about grip strength and gait speed assessments. Don't assume weakness is normal with age, it's often preventable. If you've already lost strength, it's not too late. The body is incredibly responsive, even in your 70s or 80s. Build a weekly routine that includes resistance exercise, balance work, and proper nutrition. If you're unsure where to begin, consult a physical therapist or dietitian experienced with older adults. Healthy aging isn't about staying young, it's about staying strong. And strength is something you can rebuild, one step, one meal, and one habit at a time.